Hey Yara,
Hey, how are
how are
you?
you?
I'm good.
It's
How are
been a
you?
month since I saw you last time.
I know, yeah, it's been a busy month, so
Oh, good. So let's catch up to speed so the viewers
yeah,
can know what you've been up to in your second month of your PA school.
that sounds good. Yeah. I'm remembering, I think the end of September is when we took like our first set of anatomy exam.
Okay.
This
Yes,
thing.
that's when it ended. Yeah.
Yeah, so October was like the second set of dissections that we did, and so there was one group that had to dissect more than the other group. So we did we did the back. My dissection was the back. Another group did the arm. Another group it was just like a bunch of different dissections. I'm trying to remember which one was heavy on the exam. It was pretty heavy on like cranial nerves, which was really funny because I got to remove the brain. There's not much to dissect there. uh,
Yeah.
but the exam ended up being for that anatomy exam, the turnover was so quick. I think we took our first anatomy exam, and then in 2.5 weeks, our professor was like, "Okay, next one."
Yeah.
So we were pretty rushed. We were like, "Okay, like I guess this is a quick turnaround." They wanted to end the class pretty early. I'm not sure if they do this at other programs or if they do this every year, but anatomy for Emory this year was very quick.
Very
And
quick. Okay.
so they did the whole turnaround quickly. So our second exam was really heavy on cranial nerves, which was really cool because that's something I enjoy, and I actually had to
You
demonstrate it to like the professors when I dissected the brain and stuff. So it was nice having material that you kind of were involved in lab be on the exam because then you just knew all this stuff. So it was really nice.
good. Good.
Yeah.
And you also worked in the neurosurgery floor when you were a dietitian before.
I did. So
Yeah.
it was nice seeing it come all together. I was keeping an open mind. I was like, oh, there's all these amazing things we're gonna get to dissect. Some people are doing the shoulder, that could be cool. Some people are doing kind of the arms. I was like, okay, this is all interesting. And then we get to the brain, and I was like, I'm good. I was like, this is what I like the most. So it's worked out really nice that neuro keeps coming back in a way that I like it. And it's been coming back in a lot of different topics and a lot of different ways that they teach it. So that was kind of nice. So that was kind of the second chunk of anatomy is we had those four dissections again. I only had to dissect once. Another group had to dissect once, and there's one group that goes twice. They just kind of alternate. Um,
Okay.
and each exam, it differs which group dissects more frequently. So we got to do that. And then our FMS class, I think I introduced that last time. It's our Foundations of Medical Science.
Okay.
We had just started that, I think, the last time we called, so it was the easy stuff at first. And then she gauged our interest and made it quite difficult. But our professor for that class is so smart. She used to be a pharmacist before she went to PA school.
Oh wow. Okay.
Yeah, so every time a medicine just pops up, it's almost like she knows she could speak on it for hours. She's so incredibly smart. So our second group of exams for that one was like microbiology, infectious disease, more imaging stuff too, kind of like a little intro to radiology. So that was kind of the chunk of that class too. So October was pretty busy, I will say. I
Now,
will say.
when you say imaging, what do they teach you? They teach you like X-rays, MRIs.
Yeah, and they started really small. I mean, they just kind of taught us to differentiate different types of imaging in terms of like what you see like if you're worried for a patient has cancer and you need to look more at tissues, what kind of imaging you would get versus if it's like patient coming to the emergency and you're worried about something, do you go for an X-ray or do you go for something that's more of a longer image, depending on how the patient presents. They were
Okay.
trying to do it as a slow introduction because next semester when we go more into modules, I think those specific disease states or concerns that we would learn about, we would have specific stuff that we have to do for. They just wanted us to familiarize ourselves with the terminology, which is a lot of what that class is. It's pretty science heavy. It almost feels like you're kind of in those core science classes all over again, but it's a good intro for when you move on. So the second chunk, us learning microbiology, was pretty detailed, but it's going to come back as we learn more about infectious disease and more about different stuff. They just wanted us to kind of have those resources for when
Okay.
we go into next semester to be able to look back at something because they probably won't have as much time to go into the nitty gritty of things.
Now, there was microbiology as a prerequisite for PA school, right? So they're
Yeah.
building upon that.
Yeah, building it up to the point where things I've never seen before. So it's like taking your intro and being like, okay, we assume that you guys took this, so we're just gonna keep building
Just
it up.
dive right in.
Yeah. And there's some schools that didn't, I'm trying to remember. I think some schools I applied to didn't need microbiology. I think that was the ones that was kind of school dependent. Another one that was school dependent was genetics, which I think I talked about
Okay.
is the class that I took. So micro was really interesting. The professor that taught us actually graduated from Emory. Um,
Okay.
she's our clinical coordinator. So she'll, when my time comes a year from now, she will help kind of with rotations and stuff. But it's really impressive to see how they used to be like in our place and just
Yeah.
how they speak on things. I just the level of knowledge over the span of probably 3 years is so impressive. Just seeing how much you learn in school, but also like when you're in the field in the specialty that you're in.
It's more reassuring when people who learn there come back to teach. So you know
Yeah,
there's light at
I
the end of the
like
tunnel.
it. They're like they like it enough to come back and teach. Yeah.
Yeah.
Um,
And then, yeah,
yeah.
that is interesting that, you know that you're going to be, you can see firsthand, you know where you're going to be when you finish.
Exactly, and kind of just a lot of people that stayed in the area, especially that physical exam class that I mentioned before too. A lot of the people that come precept us and come help us those days in lab are people that are working anywhere near any hospital at Emory, whether it's an Emory affiliated one or just kind of in the county. So we have a lot of students ranging from like 3 years ago graduated to even longer than that, which is really cool. Yeah.
Okay. So your second month, you said you had further dissection, you had an exam, two exams in anatomy, then you
Yeah.
had microbiology, and
Yeah.
you had foundation in medical science.
Mhm. It's funny too, because the microbiology is like one subsection of that foundation of medical science. Our exam was microbiology, infectious disease, radiology, and immunology. And
Oh,
so
okay.
yeah, so whenever you're studying, they teach you like a topic you probably learned in a semester in about 2 to 3 hours maybe. So our second foundations exam was I think the toughest for us because it was
Okay.
at a time when a lot of people were in lab
So far.
dissect.
So
So
far.
far, so far, so far for like October, I would say that was the hardest one because anatomy, when you're in there, you kind of know your material, so you can almost put that to the side and focus on other people's dissections. But when they all kind of fall at the same time,
Yeah.
it's quite interesting. When I was dissecting the back, I had to dissect on Halloween, and
Ah,
it gets a little interesting. You know, you're in there in Halloween, the vibes are spooky. You will have to go home and study. It was quite interesting being down there on Halloween, but it was still okay. It was fun.
okay.
Yeah.
So your second month, did you have any free time during this month, or it was all studies and no playing?
No, there was a little bit of fun. We a lot of people in our class wanted to do something for Halloween. So there's actually a really like nice neighborhood near Emory. That's kind of for students, more so
Yeah.
fun, just like cute little houses and stuff. So they decorated it for Halloween. And a bunch of us didn't want to go. And it was a very last minute thing. We are like, okay, yeah, like we'll go. We'll go walk around and have fun. And it was
Did
just
you
a
dress up?
I did.
What
It was a last minute outfit.
what did you dress up as?
I was intending to be a fairy, but then had nothing white to wear. So I was like fairy, like I was wearing black and put some white wings. It was not good. Some people thought about it better than I did. But it was fun. All of us just, like 20 of us just decided last minute. We were like, okay, let's just meet and go. And so everybody came to this apartment and we got to take a break. And it's funny because we're all so close now because we're almost like a little bit bonded from the
Yeah.
intensity that is school. But then you see people outside of school and you're like, wait, I didn't know all these things about you. So it's nice getting to, I don't know, just know people too. And the way that anatomy is divided, it's when you're in your dissection group, you don't really have much time to talk to other people from other dissecting groups because you're just busy in your
Yeah.
week and they're busy in theirs. So there's a lot of people that show up to these events that don't dissect with you. So you get to actually know them and like meet about 30 people that you probably haven't really
Wow.
talked to yet. Yeah. Yeah.
All these little get-togethers can help you maintain your sanity of,
Oh,
just
yeah.
studying all the time.
Yeah, because the little things that make us happy are like finding a good place to study. And once we find that, we're happy. And then once we take a little break, we remember that like there's actually so much more than finding a place to study. Like we actually maybe need to do things and like be out there. But I will say, I think first semester, I've spoken to a lot of people from the second year being in didactic and now moving on to clinicals. It is an intense first semester because there's just so much to pack in a little amount of time. But that's not to say that it's going to be that way forever. I mean, and I feel like we all came to terms with that. We were all like, okay, like I've accepted that what 4 months are going to be,
Hmm.
the whole journey is difficult, but the 4 months of just intense schooling, especially when a lot of us haven't been in school for a while, we've all come to terms with that, with the hope of next semester being kind of more relaxed and a little bit more structured in terms of learning topics at a different time. Yeah.
Okay. How much time do you have off for at the end of the semester? Do you have any time off?
Yeah, so we don't have any time off in October. Next month for November, we have Thanksgiving break, which they were really nice about. It was supposed to be a few days and then they extended it, which is nice. And then December, we get 2.5 weeks.
Oh, okay.
Yeah,
So
so we go
now,
mid-December.
so you were studying for all this, microbiology, immunology, your science, your
Uh-huh.
anatomy, and all this stuff. What did you do to take care of yourself during this time? How did you try to manage your life and your
Yeah.
academic life?
I honestly, I've been working a lot on that since kind of starting in August. I think initially I kind of walked into it not in a not understanding type of way. I just didn't realize how much time would be consumed by school, and so I didn't really factor in like, oh, like I'll be able to do all these things, but like reality sets in, and you're like, okay, there's going to be times that are more difficult than the others. I've realized too, having so much family that lives far, is I just need to designate a time and just specifically put a day where I'm doing something, whether it's catching up with family, whether it's going out with my roommate. Because that day is, I mean, you lose half a day. It's
Yeah,
not the end of the world. And initially, when you walk into PA school, you're like, no, like I can't lose half a day. Like I need to be studying all the time, and it's really not practical. I think you end up over studying to the point of exhaustion, and then you're just not doing as well as you want to do just because you're tired. And so a lot of people from the second year have been great at reminding us with that. So I've just kind of put specific days. I still don't study the whole weekend. I still try to give myself that day. The day depends just kind of how the week goes. And then I catch up with family a lot. I try to plan things with friends that live further away in terms of catching up with them, because sometimes the weeks are so busy you don't really have time to talk. So those weekends are designated for that. And I think if you're in school all week, you really are studying and you are putting in
yeah.
those hours. So it's okay to like take that day or two off on the weekend because it's not going to matter. You, especially with all the work that you've done all week, um, it just kind of balances itself out in a way. And they've done this before for so many years. So I mean, they have a strategy. It works. You know, all of us
Yeah.
being slightly tired doesn't mean that it's not a good strategy. I mean, that's to be expected kind of with the program is you're going to have moments that are busier than others or moments where you don't feel like doing anything and you just want to relax. But that in and of itself is you taking a break. So it just depends. Sometimes I'm sitting at
Yeah.
home with my roommate, like watching TV, or I'll go out and do something. But it's a form of relaxation, which is good.
Yeah, my faculty used to say, trust the system. They've
Yes.
done this for many, many years, and they
Oh,
see so many
yeah, we've
students
heard
come
that
through.
plenty.
Yeah,
Yeah, because sometimes you're studying so much and it just gets really hard and you get like frustrated with yourself because you just want all this information about
yeah.
every exam is about like 1,500 slides to study and you want all this information to lock into your brain, but sometimes it doesn't. So you just need to walk away, you need to take a break and know that like other people did that. You know, us being,
That's
yeah.
it's funny you say it doesn't, but actually it does. You just don't realize it.
I
When you
know
go
that's
to
what I'm scared
when
of.
when you go to your second year and your clinical year, when you start seeing patients, it all clicks. Because
Okay.
oh, I remember reading this, I remember studying this, or this was in this. You'll remember a particular slide as well. Like
Okay,
that's
that's good.
how
That makes
vivid
me happy.
subconsciously it is stored. Because
Yeah.
once you start seeing patients, they all come back,
Yeah.
and it makes sense.
That makes me happy because I really want this next kind of all this information that we're learning now to just click because when I was talking to my family about this earlier. When you love something so much, you want to be good at it, and
Yeah.
then you are scared that you might not be. But that's not the case. But it's just like you get scared because there's so much in medicine. I mean, it's crazy how much you have to learn, how much you're expected to know. So you just want to be good at it, and also it's people's lives. So
Uh,
that
Knowing you're a perfectionist and you want to make sure that you get all straight A's and you know everything about everything.
I
Um,
know. I would have these like moments of crisis with myself. I'm like, oh, like I won't study this, and then it'll come back to haunt me, and I'm like, maybe I'll see this in a patient. So then I'll open the book again and like start.
Yeah. You're your own worst enemy.
Yeah,
If you
you
if
really
you
never know. You never know kind of until you're out doing clinicals.
yeah.
At this point, we're just kind of like learning it all and hoping it sticks. But I will say the hands-on stuff that we've been doing from dissecting to those physical exams have been so nice. And that class has been really nice too. That's the other class we're in. We're still learning like different body systems, different. So we did more like female and male GU. So we learned how to do some of those exams. We did neuro, MSK. So those stuff are really interesting too, because when you're in a clinic setting and you have to assess these things or do these exams if you're in primary care, that was cool. So we've been doing that 1 week at a time to build up into this like big physical exam that we have to do in November. So they've been teaching us the skills slowly to get us to that point in November.
So you are doing physical exam and learning physical exam as you're learning your theory as well.
Yeah. And then that class is more so like it's an intro to physical assessment, and it's more so like they'll teach you stuff about neurology, but more it's a lot of like terminology, a lot of assessments that you do versus diagnosing or prescribing anything. They just want you to recognize, okay, if this looks off or if this is not what normal would be like in a normal patient, this is what I need to be worried about. And then that way they can kind of feed into that next semester so that we have the skills, but then we can back it up with the information, which is really cool.
Now, when you're doing this physical exam skills, you're practicing on each other with your fellow
Yeah,
classmates.
yeah. You're supposed to have a partner that's with you the whole semester that you practice with. So my partner and I, like we would switch. Like I would start first practicing on him, and then he would move on and practice to be the PA student practicing on me. And we just kind of they give us about an hour and a half every week to go in and like practice new skills at a time. They don't teach you a lot all at once. So they'll just teach you one topic at a time and then teach you the important skills they want you to know in terms of like eye, ear exam, mouth and throat. Like we got to do some of that too. And so we'll just go in, we'll practice. And then really it's just building it up for next month for when we go in and pretend to be the PA student and kind of run through the whole thing.
Yeah. When you talk about eye exam, the first anxiety I used to have was like, am I able to see the fundus? Have you seen the fundus?
Yeah, no, it's so funny too, because at first they wanted us to try to like find the cup and they were like, look at the cup to disc ratio. And then our professor came and he's like, no, that's too hard right now. Like focus on just being able to recognize these things now. And then when you are learning stuff about the eye, you'll know what to look for. But like at this point, we were just learning like the terminology of things. And he was like, you won't be able to see anything wrong because you know, your partner has
This is
great vision.
normal. Yeah.
Yeah, he was like, we just want you to be able to see it, know what normal looks like, and be able to kind of repeat that when you're worried about a patient or doing an eye exam. So that one was pretty interesting too. And there's just little things that kind of they remind you, like if you're doing an ear exam, make sure to pull up on the ear so you're not bothering the patient. You're not it's just little things that like when I'm in a clinic as a patient, I would have never realized they were doing all these things. So it's good that they're teaching it to us now because really you could hurt someone if you're not really
Yeah.
careful with things that you do.
Patient comfort and patient modesty are
Yeah.
two main hallmarks when you come to physical exam. And then, your operator, the examiner's comfort. So you should be comfortable so that
Yeah.
you can conduct the exam. The patient needs to be comfortable so they can tolerate the exam.
Yeah.
And,
Exactly.
they're not like shy or, you give them enough privacy when you do the exam. So all these matter. Little things matter.
Yeah, and it's like you don't really think about it. I'm like, I'm
Yeah.
sure I've had so many ear exams in my life. I never really realized that they do certain things to make sure I'm comfortable. So it's nice that we're taught those little things kind of one piece at a time. So it's not forgotten kind of in the midst of all the stuff that we're learning, which I really do appreciate. Yeah. So
Okay.
it's good.
Yeah, you should start practicing on a lot of other of your fellow classmates as well.
Yeah.
You'll
No.
see so many differences. They're normal, but you'll
Yeah.
see different anatomic variants, and the more you see, the better off you'll be.
Oh, we've been practicing on each other too, and my partner has really bad astigmatism, so it was there. I mean, you could try to do the eye exam, and I
Yeah.
needed the help. I was like, I can't see anything. Like, and then he would look into mine, and it was great. And I was like, I want to see what normal is, but your vision is not great. So it's just things like that. So it's fun. You kind of learn through a lot of different people and you practice. And so many students learn differently. So it's nice
Yeah.
to have one partner for the physical exam, but I maybe learn differently than he does, or he practices differently than I do. So it's nice that we all kind of have a group of friends that we can just really practice on each other. or if I study it differently than he does, I want to make sure he does it his way that works, and I
Yeah.
do it my way that works versus like either one of us having to do it a specific way. If we're doing it the correct way, that's really what matters. But some of us just learn it differently. So that's when been nice is when we go to these physical assessments, we're in those suites that look like a patient room, but there's multiple of us in different ones at a time. So we get to like swap around and ask questions.
Yeah, that's good. Now you mentioned that you're studying, in groups, and everybody has a different lifestyle,
Yeah.
different learning style. Now, have you noticed other students? Now you've got to know more of your classmates. How many of them are like non-traditional? Are they everybody in the science background, or somebody come from a completely different background and took the prerequisites and came into PA school?
I did find out recently that we have one person in our class that was a teacher before.
Ah,
And I think she's the only one. And she,
ah,
I think, we taught first and second grade. I'm not sure. I think it was math and English, but I'm not entirely sure. So I found out recently that she did that. Everybody else, it seems like honestly, the majority of our class either did dermatology, or we have a few that did ENT, some that worked with hand surgeons. Um,
okay.
we had some people that work with hand surgeons that were really excited for next month's dissection when they had to dissect the hand. So they were really looking forward to it. Um, Neuro, I've realized a few people from my friend group actually did neuro before. So there's few people that love neuro as much as I do. So
Oh, good.
getting their excitement with it too has been nice. I'm trying to think of other people. A lot of them did take at least a year off. I think the
Okay.
majority only took 1 year off to kind of build hours and apply, with the exception of I think the two that I mentioned in the last call about them just going straight from college. The rest took anywhere between I think the majority actually took 1 year off, but the rest were maybe a longer process like myself,
Okay.
and more time off. Yeah.
That's awesome.
Yeah.
Anything else interesting happening in your second month?
In my second, I'm trying to think. I've been crashing studying. It's been fun though. I think my parents laugh at me every time I say this because I'll call them so stressed out. And I'm like, no, it's just too much. It's too much. I can't do it. And then I'll take the exam and I'll be fine. But then I kind of miss it. Like
Yeah.
there's something weird about studying when you do it all the time. You hate it, but then you take the exam and you're like, oh, like I actually kind of missed this. Like this was good. Prepping for we were able to get those second dissections out of the way, which is nice. So it's been just kind of heavy studying for those exams that I was telling you about. But no, I mean Halloween was our biggest one.
Yeah.
Halloween was our busy time. It was good. We
Yeah.
had one thing to celebrate. And otherwise it's just been really, I'm very lucky to have a roommate that's in the program too that kind of understands. So but we'll both check in on each other and be like, okay, let's go for a drive, let's take a break. So it's just been little things like that that kind of have
Yeah.
made it fun, honestly.
It's interesting you said that you missed that study when the exam is over. It's like
Mhm.
runner's high. When you're running, initially it's kind of hard, but once you're in your zone and your groove,
Yeah.
it just kicks in another gear kicks in, you just keep running.
And you just keep going.
Yeah.
Yeah. It's like, I don't know. I am someone that enjoys studying, which is pretty rare. I think not a lot of people like to sit down and study. I enjoy it. I like sitting down. I like learning it. If I'm not on a time crunch, I'm sure it's really stressful when you're on a time crunch. But I do miss it after the fact because there's a lot of topics that we learn. We're not going to love every topic we learn. There's some things I'm going to enjoy more than others, but there's a few that at each exam, for example, like infectious disease was really interesting for me. Just learning
Yeah.
about the antibiotics, learning about different medications you can give was interesting to me. Micro, not my favorite, but it
Yeah.
was just like certain things that you kind of just like learn as you go. So I missed the parts that I liked. So I'm hoping I get them again sometime next semester, which I'm sure I will.
So they're introducing pharmacology along with these topics
Yeah.
they're studying. So what medications to give and antibiotics and stuff like that. So
And
along with the system, they're giving
yep.
you. Okay.
Um, for the physical assessment class, not really. They just want us to learn how to do a physical exam. The one professor for foundations of medical science, just because she has a really good background in pharmacy, she'll actually be the one teaching us like the when we're doing pharmacology for every module next semester, she'll come back in and teach them. So
Okay.
she likes to introduce us to terminology before. So she'll make sure that we kind of understand more mechanism of action, how something works, if something is contraindicated, pregnancy being a big one for a few of them. She
Hmm.
wants us to just familiarize ourselves with them so that when we actually get to next semester, these aren't all like a lot of new words that are
Yeah.
might be terrifying to learn. So she does a great job. I'm a huge fan.
Well, good. That's
Yeah,
good.
yeah.
Okay.
But yeah, I think it's kind of been October. Um, we're doing it.
Yeah.
I'm gonna do it.
I see it. I
Yeah.
see that confidence in you, the way you talk, the way you talk about the subjects you're studying. Yeah, it's completely different from didactics and what you're talking about nutrition. Now you're talking about a lot more stuff.
Oh my gosh,
You're
I
talking about
can't.
antibiotics. You're talking about infectious disease.
It's so
Yeah.
funny because they'll mention something in class and it would be like nutrition related, and like everybody in the class looks at me because I'm the only dietitian in the class. I'm like, don't look at me. It's in the past. I do love it though. It really has helped me in so many things. It's come back a lot more than I realized too, but it's so nice because everybody will look at me and they'll be like, Yara, like it's back again. I'm like, no, it's okay. I said my goodbyes.
Yeah.
Yeah.
Yeah. Okay. Well, it was nice catching up with you for the month of October.
Yes, you too.
Looking forward to catching up next month in November.
Me
Okay.
too.
Okay. Well, until then, happy studying.
Thank you.
See you in a month.
Bye.
Bye.